Let's jump right into this explainer. Today, we're zeroing in on something you interact with all the time, but, probably never really think about. Picture the medical world as a giant living organism. If hospitals are the organs and doctors are the immune system, then healthcare distributors, they are the invisible bloodstream. They're these massive, complex networks that purchase, inventory, and deliver literally all the pharmaceutical products and medical equipment that keep the entire system alive. But right now, that bloodstream is under immense pressure. So we gotta ask, what is the absolute biggest threat to the medical supply chain today? Well, you might think it's a lack of new drug discoveries or maybe, regulatory hurdles. But actually, the reality is much more foundational. The massive behind-the-scenes networks that deliver our life-saving treatments are facing an existential operational squeeze. We're calling this the modern squeeze. The entire sector is facing this relentless, totally cutthroat push to slash costs while simultaneously moving faster. Margins are getting tighter and tighter, and at the exact same time, the industry is undergoing massive consolidation. Distributors are navigating an incredibly complex web of partnerships between pharmacies, insurance payers, and drug manufacturers. It's a high-stakes balancing act for sure. And to survive this modern squeeze, these companies need a very specific playbook. Okay, let's dive right into the solution. Enter the framework from the Sustainability Accounting Standards Board, or SASB. Now, while the name says sustainability, you should really think of this as the ultimate survival and accountability playbook for navigating these exact modern challenges. Investors are literally using these exact standards to figure out which distributors are built to survive the squeeze and which ones are secretly carrying massive, catastrophic risks. So here is our roadmap for this explainer. We've seen the modern challenges. Next, we're going to cover the SASB framework itself, then efficiency in logistics and life cycle, defending against counterfeit drugs, and finally, product safety and ethics. Let's get into it. Section 1, the SASB Accountability Framework, and how we actually measure all this unseen machinery. To survive the squeeze, investors use this brilliant scorecard that basically distills massive operational complexity into 5 core topics: fleet fuel management, product safety, counterfeit drugs, product life cycle, and business ethics. If you want to know if a distributor is actually efficient and minimizing risk in a rapidly consolidating market, well, this is exactly what you look at. Over the next few minutes, we're going to unpack exactly what these mean on the ground. Section 2, efficiency in logistics and life cycle. This is where that sector-wide push to cut costs gets highly, highly tangible. Think about it. Moving medical supplies requires a staggering amount of transportation. We're talking air, marine, rail, road, the whole shebang. With fuel cost fluctuations and obvious climate change concerns, fuel economy is absolutely vital. But you don't just measure miles per gallon when you're hauling tons of heavy medical equipment, right? You use a metric called liters per RTK. That's revenue ton kilometers. Try saying that 3 times fast. It's basically calculated by taking the distance the goods were transported and multiplying it by the metric tons of the payload carried, completely excluding the vehicle's weight. It tells investors exactly how efficiently a distributor is moving actual revenue-generating product. And to get those liters per RTK down, distributors are pulling absolutely every lever they can. They're upgrading their fleets for better fuel efficiency, shifting over to alternative or renewable fuels, using advanced software to optimize their logistics routes, and even implementing strict idling reduction programs for their drivers. Every single drop of fuel saved is a direct counterattack against that industry-wide margin squeeze we just talked about. Now, this efficiency completely extends to the product lifecycle too, specifically packaging. So think of primary packaging as the actual pill bottles sitting in your medicine cabinet. Tertiary packaging is the massive bulk crates and pallets used to actually get it there. Distributors have ultimate control over that bulk side, and they have to manage incredible amounts of waste just to keep their costs low. Where they do have control, they are super aggressive. They use strategies like dematerialization, which, let's be real, is just a fancy word for making the packaging thinner and lighter. They use certified paper, they design materials for ready recycling, they consolidate shipments, and increasingly, they're shipping products in heavy-duty reusable containers. Again, this isn't just about being eco-friendly, it's a very measurable efficiency strategy to survive those cutthroat margins. And the life cycle efficiency doesn't just end when the product is delivered. What actually happens to expired drugs or used sharps or old medical devices? The framework tracks the exact metric tons of drugs and devices accepted for take-back that are then reused, recycled, or donated, rather than just being tossed into a landfill somewhere. Safely managing these end-of-life products is a crucial sustainability and honestly cost-saving metric. All right, Section 3, defending against counterfeit drugs. If distributors are the bloodstream, counterfeits are basically a deadly virus trying to infect the whole system. According to the World Health Organization, counterfeits represent more than 10% of the pharmaceutical supply chain in low and middle-income countries. And let me tell you, they are a massive risk in developed economies too. A counterfeit in this world isn't just a knockoff handbag. It is a drug sold without authorization that might lack the active ingredient entirely, or worse, contain something totally toxic. Or it might just have incredibly convincing fake packaging masking a cheap imitation drug. If a distributor lets even one of these slip through, patients are harmed, and the company's reputation is instantly destroyed. To stop this, distributors have to act like a highly secure border patrol. They don't just, ask nicely. They use rigorous physical inspections, unannounced audits, and they demand third-party good manufacturing practices and quality management system certifications. It's a high-stakes clearance process. They absolutely must know exactly who they are buying from at all times. And once that product is in their hands, they have to maintain absolute traceability. They build this sort of digital fortress around authentic medications using RFID tagging, advanced barcoding, and direct coordination with law enforcement to track the chemical history from the raw factory floor all the way to your local pharmacy. They even deploy immediate alert systems for business partners if anything looks even slightly suspicious. Section 4, Product Safety and Ethics, which is really the bedrock of the entire system. Distributors share a massive responsibility with manufacturers to ensure the actual products are safe. This means actively monitoring for toxicity and chemicals of very high concern. It means tightly tracking controlled substances that have a high potential for abuse. It also means ensuring the proper dosage is dispensed, that products are correctly labeled with safety warnings, and implementing things like the right sizing of packaged dosages, so there isn't dangerous leftover medication just floating around your community. And behind all of this is corporate integrity. Remember that massive industry consolidation we mentioned earlier? Well, in a fiercely competitive market where literally everyone is getting squeezed, the temptation to cut corners, bribe officials, or fudge marketing claims is immense. Distributors enforce strict ethical codes to prevent this. They regulate how business intelligence is gathered and oversee marketing claims to prevent fraud, enforcing compliance through constant training and incredibly strict review committees. So the crucial point is this. How do investors actually know if a company is failing at safety or ethics? They look at this single, devastating metric, the total amount of monetary losses as a result of legal proceedings. If a distributor has a sudden spike in civil judgments, regulatory penalties, or criminal fines related to product safety or bribery, it means their internal systems have completely failed. In this industry, ethical and safety failures aren't just a bad PR day, they result in massive financial losses that can completely sink a company. Which leaves us with this final thought. The next time you pick up a prescription or see a medical device being used, ask yourself, how much trust are you actually placing in that invisible supply chain? Behind that little bottle of pills is a massive, highly scrutinized network battling for fuel efficiency, fighting off counterfeiters, and navigating a high-stakes, consolidating market just to get it to you safely. It's a complex, hidden world, but as we've seen today, every single drop of fuel and every barcode scan truly matters.